Hello, this is Brenda Kelly calling from the Magnet Commission.
We are absolutely thrilled to receive your call today.
I'm excited to be calling you. We are pleased to tell you that your application for Magnet designation was approved at our meeting.
We are magnetized.
In 2004, we celebrated achieving Magnet designation, the culmination of a 2-year journey that changed the way we care for patients, the way our nurses interact with healthcare teams, a journey that changed Rochester General Hospital.
Our vision is a simple but an exciting one. It's to earn the confidence of our community and over time to be this community's healthcare provider of choice. Our mission really is about making a difference in the lives of our community, and our nurses are at the front line of our organization. They are the expression of how well we carry out that mission that has guided our organization for more than 160 years.
And the journey continues. At RGH, the role of nurses is constantly evolving, driving positive changes and making a difference in the lives of our patients every day. Our belief that every nurse is a leader starts with our leadership team, professionals with a depth of clinical knowledge and experience. They create the vision that inspires our entire nursing staff. Our leadership embraces the principle that every nurse's voice counts. Our shared governance model provides the tools they need to become leaders within their teams and their profession. At RGH, our professional development program encourages nurses to pursue certification in their chosen area of specialty. Certification not only enhances the clinical knowledge our nurses bring to healthcare teams, it improves patient outcomes and increases their feelings of empowerment and job satisfaction.
Mentoring new nurses is one of my favorite things to do. I get to share my expertise with them. I get to share my passion for nursing, my love of the patients with those nurses, and hopefully they feel that from me and they want to do the same thing. A very important piece of nursing at Rochester General is professional development. And it's always about the patient. But as you go through school, as you learn how to deal with patients, as you learn how to become a clinical expert, you're giving the patient better quality care. And that's what we're all about, is giving the patient the best care that we can give them.
The Nurses of Tomorrow program, developed by our nursing staff, is also helping to nurture the next generation of nurses. Observing the critical contributions nurses make at RGH passes on our vision and passion for the future of nursing and helps strengthen critical connections between RGH and the community.
It made me want to become a nurse because I actually saw what it entailed and how much it takes. Some people think it's it's a snap to become a nurse.
Being involved with Nurses of Tomorrow just made me want to work even more, and seeing all the nurses working together and being a group and all united just made me want to be in there too.
Perhaps nowhere has the impact of Magnet designation been more apparent than in the transformation of our model of care. Continuous improvements and enhanced interaction between nurses and patients are reigniting the passion that first attracted our nurses into the profession.
Magnet designation has meant a great deal to the physicians at our Rochester General Hospital, and some of those things are the interaction of the highest quality nurses with the physicians around patient care, the excellence of the nurses at the bedside in their patient care activities, and the ability to recruit and retain excellent nurses. And the quality of the nursing staff is vital to medical staff and the provision of good care in the hospital, and Magnet status has really brought that to Rochester General.
Our new model of care includes preparing a daily plan of care to meet each patient's needs and reviewing the plan with the patient or family. Going over the day's tests, procedures, and medication orders helps patients know what to expect and minimizes their anxiety. We have also implemented new rounding procedures in all units. These regular checks maintain patient comfort levels and ensure early intervention. Nursing huddles and Magnet moments also give our nurses informal opportunities to share stories of nursing at its truest and best.
I had a heart attack on May 24th. I was taken care of excellently by the nurses. I stayed there for 4 days, and they looked in on me quite often. At one point, I remember it might have been after I had been there for 2 or 3 days, I started to cry for no apparent reason. And the nurse happened to come in when I was sitting on my bed crying, and she sat down next to me, and she put her arm around my shoulder and just sat there and tried to she didn't say very much. She just the fact that she was there and that close helped me quite a bit emotionally.
At RGH, nurses continue to bring science and evidence-based practices to the art of nursing.
If you look at the culture that we have at Rochester General and the history that we have, we drive all of our programs to excellence, and we drive them to national excellence. The core and the backbone of the hospital, the very substance of that culture really resides in the nursing and in the interaction of nursing to patients. They're the ones that are the closest to the patients. They're our eyes and ears. Nursing and getting the magnet status has shown that they have reached the very pinnacle of accountability and reaching the bar that they set to be very high many, many years ago.
The Early Nurse Intervention Team, or ENIT program, was developed to provide nurse-to-nurse consultation. The ENIT nurse, an experienced ICU nurse, rounds on the general units twice daily to assist in patient assessment, early intervention, and communication with providers. This nationally recognized program improves patient care. It also helps new nursing staff refine patient care skills. In our Nurses Improving Care for Health System Elders, or NICH program, every unit identifies a nurse to be trained as a geriatric resource nurse. The GRN team is currently piloting a program and gathering data to document improved quality of care and outcomes for elderly patients.
I think what really excites people about geriatrics is these are our most complex patients that we take care of. They require a high degree of knowledge and skill. There's been a lot of research in recent years, which allows us as nurses to apply that evidence in our daily practice. And this becomes very exciting for the nurse once they become hooked on geriatrics. We used to think there was not much that could be done for our older patients, but now, because of the new evidence, we realize there's so much we can do.
Magnet designation has inspired RGH nurses to strive for proven results that mean better care for our patients. Our Skin Initiative uses ultrasound to detect developing skin ulcers before they're visible to the naked eye. Early intervention has resulted in significant reductions in the number of patients suffering from skin ulcers.
We have a very enthusiastic group of staff nurses that make up the skincare liaison group. We've recently identified a second nurse out of that group that we're going to send to school and develop her to be a resource to us as a woundostomy continence nurse. Ultimately, we'd like to eliminate pressure ulcers and improve the care of wounds.
To minimize the risk of medical errors due to miscommunication, the SBAR initiative ensures that critical information about each patient is communicated consistently and completely between all members of our healthcare teams. What began in 2002 with the inspiration of a single nurse has become a groundswell. Now more than ever, our nurses are integral to the quality of care at Rochester General Hospital. We're passionate about nursing and dedicated to our patients, our hospital, our community.